treated thousands of runners, and I want to show you the 3 clinical patterns I see all the time and the easy solution for that problem. Let's dive in. Runners get bone stress injuries and tendon-related disorders. We're going to focus on the tendons today. Specifically, we're going to focus on the patella tendon, this bad boy right there. A common sore spot for distance runners. Let's go through these 3 clinical cases. Case 1, we've got an adult marathoner with right-sided patella tendinopathy. Specifically, they have symptoms when they're running farther or faster. The interesting thing about this archetype is as you take them through their examination, it's really unremarkable. They can squat, they can do single leg tasks, you can take them through range of motion and stress testing, all these other things, and they're really asymptomatic. The only thing that brings on their symptoms is running. You need to change how they're running. Specifically, you want to look at the things that are symptomatic for them, faster running and farther running. Let's go through those longer efforts first. We have a few different options. First, if they naturally have a lower step rate, ideally 165 steps per minute or less, you can have them increase their step rate by 5 to 10% on their longer efforts, and that should be helpful. If they don't fall into that category, or step rate manipulation doesn't help, the second thing you can do is to break up their long run. Have them continue to do all their training that is not problematic, but with their longer efforts, take the effort and divide it into sections. If you're going out for a 10-mile effort that's symptomatic at 8 miles, have them run 2 to 3 miles, walk for a couple minutes. 2 to 3 miles, walk for a couple minutes. Have them do that for the same duration of 10 miles, but just split it up. Often, if you just manipulate their step rate or break up their long run, it helps push them in the right direction. You can still give them some exercises to work on, but the main thing they need to focus on is running. They're having pain with intensity. Again, take the same effort, let's say a tempo run, and divide it into sections with a little bit of walking. Often, if we just split up their symptomatic efforts, keeping their volume about the same, we put them in the right direction. All right, case number 2. Again, we've got an adult marathoner with right-sided patellar tendinopathy that has symptoms when they run faster or run farther. The interesting thing about this patient is as you take them through single leg tasks, they struggle to balance or move with control on the affected side. They don't really have symptoms when they squat, when they go onto one leg, or when they do other exercises, but it's harder for them to be coordinated on the affected side. This is a patient that needs exercises. Pick your favorite single leg exercises, get them doing them in a slow, smooth manner. I'll advise these patients to move with precision. You can still make some of the modifications that we did with the first patient, but with this patient, they need to tease out that difference side to side to get in the right direction. All right, let's move on to case number 3. Again, you've got an adult distance runner with right-sided patellar tendinopathy, but when this runner shows you their training plan, they struggle with consistency. They might run on Monday, they might run on Saturday. It's kind of variable in nature, and they have some symptoms, but they're not terribly bad. But they're struggling to figure out how to progress through this. You need to get them running more. Try to get them running every other day at a conversational pace, at a level that doesn't put them into red flags. Our red flags are pain that goes above 4 or 5 out of 10, forces them to run differently, doesn't resolve within 24 hours, and that patient is not comfortable with them. If they have any of that, they have to stop. But we need to get them running more often, even if that means running through some symptoms, as long as they're not pushing into these red flags. They have to prove they can maintain a consistent training schedule. Exercises are great, but this person needs to audit their schedule and make sure that how they're approaching running matches their life at this time. Understanding when to pull a patient back, when to prescribe more exercises, and when to push them through pain is really important. I hope this video helped highlight that to you. If you like this type of content, I'd love it if you like this video and subscribe to my channel.